My name is Stephanie Dunn and I work for the Royal College of Nursing, and thank you for inviting us today. One of the things we know is that COVID is still with us. We know that it is airborne, and we know that healthcare workers are at risk due to the nature of their work. And the question really is, why then did HSE not provide specific guidance for health and social care sectors regarding the use of respiratory protective equipment and publicly clarifying the airborne route of transmission?
So, well, thank you very much for your question, and we very, very much appreciate what you and all your members do for all of us and all of our families, and so thank you for raising that question, which I'm sure Philip will be happy to talk about. Or maybe
I was just going to wonder, because Rick was involved in some of the central discussions alongside Andrew Curran.
Yeah, okay, thank you. I mean, the situation in COVID obviously was one that evolved and everything was moving as knowledge was developing. Certainly within HSE, our sector teams that are used to dealing directly with the health and social care sectors were giving that direct advice, but we were also working very closely with the Department of Health and Social Care so that they were taking the lead, what they were recommending. And they said it was an evolving situation based on knowledge as it went. So the regular meetings with the SAGE committee and our chief scientific advisor was involved in that, those circumstances. Very much early on, it was looking at those that were directly involved with aerosol generating procedures and recognising that was the level where PPE was needed. And of course, PPE is always the last resort, so we were very keen on making sure that there were management approaches and approaches to managing the circumstances differently. So it wasn't as simple a picture as just saying, straight off, this should be something that we control with RPE, and nor is that situation that clear-cut now, as things have changed over time, vaccination programs, etc. So all of that collectively was going through that sort of central approach to how the government was advising on the pandemic.